Indiana University say they have made a breakthrough predicting and treating breast cancer, and some of that research was done in the tri-state. Eyewitness News' Raven Ford has the details about what's being called a groundbreaking discovery.
For more than 4 years, Indiana University researchers have studied ways to detect possible signs of remaining triple-negative breast cancer material before relapse. Triple-negative breast cancer is one of the most aggressive and deadliest types of breast cancer because it lacks common traits used to diagnose and treat most other breast cancers. Some of that research was conducted in the tri-state at Oncology and Hematology Associates of Southwest Indiana in Newburgh. Dr. Brian Schneider is the co-leader of the research project. He says 90% of patients who went through chemotherapy and surgery were cured.
Conversely, the other 2/3 that have residual disease that's removed at the time of surgery have a much higher risk of relapse and death. So about half of these patients will have recurrence.
So what's scary is for these patients who have residual disease, we know that they're at high risk of their cancer coming back, but we really don't know which patients' cancer will come back and which will not.
During the study, researchers used innovative technology to take a simple blood sample along with special techniques to detect a tumor cell. 90% of those without it were found to remain cancer-free after 2 years.
But I'm also a triple-negative breast cancer survivor. So for me, very hopeful for the future and continuing my survivorship without a recurrence because, this lays a foundation for more trials, more interventions, and more therapies so that individuals can be hopeful about just their life.
Raven Ford, Eyewitness News.